Welcome, everybody, and our our gratitude to Shantae Standing Rock for that wonderful, wonderful performance. We pray for health and happiness on this Sunday night, the first Sunday of the month of December 2021. And thank you for joining us. This conversation, we can do this, Indian country, a conversation about the state of COVID-19 pandemic in our communities across Indian country, how the booster shots are going. If you've had your shot, all adults are being recommended for boosters, and how the uptake is going with the Pfizer vaccine and children 5 and older across Indian country, particularly the Southwest. I'm David Kenoyer, and an enrolled member of the Rosebud Sioux tribe, also with family connections, many Kenoyers from the Yankton Reservation. It's very good to be with you on this Sunday night. And we have several speakers from across the Southwest. And this has been a number of town halls that we've had to talk about COVID. A couple weeks ago, we were talking to folks in the Northern Plains, the Dakotas, and Montana, and we're focusing on the Southwest today. This is part of the We Can Do This campaign sponsored by the U.S. Department of Health and Human Services. And there are a number of tools at www.wecandothis.hhs.gov that are specifically tailored to the American Indian Alaska Native community. Some posters, some flyers, and we'll hear in a little bit new radio ad that is encouraging people to get vaccinated. Across the country, 60% of Americans have been vaccinated with 2 shots, 60%, 6 of 10. The numbers in Indian country vary. Sometimes they're higher, and sometimes they're not at that 60% threshold. And we want to talk tonight about how to have those conversations with relatives and friends who are still on the fence, who are still not quite sure, or who might just be kind of tuned out at this point, nearly 2 full years into the pandemic, right? How do we stay vigilant with now news that there's a new variant coming, right? We've been dealing with the Delta variant for months, and you've all heard the news of this new Omicron variant, supposedly from Southern Africa, but it's already spread in the United States. I am based here in Minneapolis, Minnesota. We've had a test positive for the Omicron variant in Minnesota, and it's probably just a matter of time before that variant spreads. And we can get into the fact that the variants are important a little bit later, which makes the case to get vaccinated, because data show that if you're vaccinated, you're less likely to get really sick, and you're less likely to be hospitalized, whether you catch the coronavirus or not. Again, this is We Can Do This Indian Country, part of the We Can Do This national campaign under the Department of Health and Human Services. In the past, the Indian Health Service has been a partner with this in HHS, and a number of local partners from the Montana tribal leaders, or the Rocky Mountain tribal, what is that? The Northern Plains? No, Rocky Mountain Tribal Leaders Council was part of a previous show. While my tongue is tied, let's get to our first guest, who's patiently waiting for us and who's making time for us on a busy Sunday night. Chairwoman Amber Torres from the Walker River Paiute tribe. Thank you so much for joining us, Chairwoman Torres. We know that you're busy. I think you were saying earlier you're in Las Vegas, which is a pretty common place for consultations and meetings to happen. How are you doing tonight, and what's going on in Vegas to keep you busy this weekend?
Hi, good afternoon. Pija Tabino. Again, me, Amber Torres, me nania nu agada karapoinabi na agaigwe. So good evening, everyone. My name is Amber Torres, chairman for the Walker River Paiute tribe in Shores, Nevada, joining you by way of Las Vegas this evening. We have some big consultations coming up with the USDA regarding the upcoming farm bill, and privileged to be able to join the Indian Ag Council this week here for the conference and consultations going on this week. So thank you for having me.
Thank you for joining us. So much on your plate, right? I think it's really remarkable how much work that tribal leaders like you can cram in a busy day, from agriculture to health and wellness to culture to the economy to you name it, right? Transportation, jurisdiction. Uh, what's the latest with COVID? What are you hearing in your community, the communities around you? What's the latest?
On our community right now, we've been hit pretty hard recently. In the earlier months of COVID, we took a lot of precautions to shut our reservation borders, shut all recreational areas down, put curfews in place, those types of things. And as we started to open up, our numbers had still been quite low. And kind of in the last few months, we've really been hit hard with COVID-19. We were as high as 37 people positive at one time. As you know, we do shopping for our positive patients, with the limited staff that I have on hand. And, it's been a challenge. We've been seeing a lot of our young, strong, and healthy end up in the hospital with COVID pneumonia. And unfortunately, we've also lost a few of our elders and some of our population due to COVID-19, where we haven't been hit with this before. So it's been absolutely devastating. I am pleased to say that, since the children have been approved for the vaccination, we have been getting kids signing up left and right, which is a really good thing, I think. And we've also finally gotten our boosters in. And the first day that we had clinic from 9 to 11, we did a drive-through and we had 200 of our population show up, which was outstanding for Walker River. So, I am happy to say that our numbers are back down to around 8 right now. But, just because they come off as far as the quarantine time and not considered to be positive anymore doesn't mean that we're not still watching them to monitor for ongoing COVID complications. So, it continues to be a challenge. We're still continuing to watch the new variant that's coming out and just hoping that it takes its time to get to us, as well as Indian country.
When you refer to 8, you mean what, active infections or late infections of recent period?
I'm sorry, did you say aid?
8, when you refer to the number
Oh,
8.
8, yes. As of this past Friday, we have 8 positive COVID-19 patients.
And when was your drive-through? Because drive-throughs became pretty popular, right? When the vaccines were first coming out, and as for testing too, with trying to keep distance and everything. How did that go, and when was that?
Absolutely. We just did our booster drive-through on December 1st, so it was not too long ago. But again, we are open at our tribal health clinic for COVID testing and vaccinations each and every day. So we just make sure that our people call in, and we can get them in right away and make sure that they're safe and sound going forward. So I am very happy about that.
Yes, I got my booster more than 2 weeks ago. I was kind of surprised. You know, at the very beginning when we got the first round of shots, right there was more. There wasn't a lot of vaccine at the time, right? So you kind of had to
Right.
wait your turn, and I kind of expected the same. This would have been maybe 3 weeks ago, and it was much more casual. And um, now they're recommending, right, all adults are recommended to have a booster 6 months after your
Right.
second shot. And
Right.
if you got the J&J, the one dose, 2 months after that. uh, but all adults are recommended to get that booster. Of course, that means we want you to have gotten the initial round of vaccines. Are you are you still faced with folks who haven't been vaccinated at all? And what do you say?
Yeah, definitely we are. It has been a major challenge, to try to entice people. And I don't want to say entice, but give the education for the people to make a sound decision and give them that option. We have actually done an incentive program at Walker River Paiute Tribe, where if they were to get fully vaccinated, we would pay them $500. And again, that's not, that's not enticing them. That's just saying, thank you for taking care of our community. Thank you for taking care of yourself and each other, because again, we never want to see any of our tribal citizens expire, let alone get sick and end up in the hospital because, right now we know they're so overwhelmed. The staff is overwhelmed, at these facilities. And, basically the people are overwhelmed, with the continuance of COVID and now, new variants. It just feels like it's never going away. But I think if we continue to vaccinate and, get boosters and do our part, by continuing to social distance, wear our masks, and think about the other person and not just ourselves, I think we can at least get a hold on it for sure.
And if you read articles about this, right, so much of where the variants are coming from, right, is that the virus is going to adapt and change and mutate among folks, particularly who haven't been vaccinated, which is constantly going to rotate and kind of spin new variants off, probably for a while, right, until
Right.
a larger part of the community is vaccinated. Um, I thought I saw you a couple 3 weeks ago on the White House Tribal Leader Summit. Was that true?
Yes,
What
it was.
what's your experience been with the tribes and IHS and Indian Health Service and the federal government with coronavirus? Has it been pretty coordinated, pretty seamless? And as a tribal leader, what have you observed?
I can definitely say when COVID-19 first hit, I think the biggest barrier that I see is that all of our supplies and all of our funding has to go to the state and then trickle down to the tribes. I think that's one thing that I would definitely want to change for future reference is that any funding go directly to the tribes and any future access to supplies go directly to the tribe. I think we've shown our resilience this whole time and shown, that frankly, we're doing it. We're getting it done and we know best how to take care of our people. Um, and I think that's one of the biggest challenges that I have seen this far. But I can say over time, we've gotten pretty versed on, how to take care of one another, how to share best practices, um, and how to help one another. And so, as time goes on, we are continuing to keep ourselves educated, keep up on the newest information, get the information out to our constituents, so again, that they can feel that they're making their own choice and they're as educated as possible on anything that, that's out there that they have questions on. But, I think the biggest thing is just making sure that, again, all the tribes have everything that they need access to, and that we do it fast and efficiently, because with the comorbidities that are on our reservation, the high prevalence of diabetes, all of the different issues that we face in Indian country, access is a huge barrier, and especially for rural tribes such as ourselves.
And the more of those chronic health conditions you have, right, the greater your susceptibility to serious illness with COVID increases. And
Absolutely.
it just seems like almost some sort of catch-22, right? There's a lot that we need to be working on, and this is just one more thing, right? Because of the situation that many Native people have found ourselves in after 250 years, right, of not living the way that we used to live,
Right.
and now this triple whammy. um, where does your planning for the future? Are you even able to plan with something like this? Constantly reacting right to a terrible crisis, W- and you hear about healthcare workers, providers being exhausted
Oh
and
yeah.
systems being overwhelmed. How do you get in front of this as a government?
I can say that right now I have outstanding and amazing staff, that continually keep up with, like I said, the education, the information, the best practices, What is our next step? And they're always one step ahead, and we're a small knit community, where we're continually sharing ideas, reaching out to our other tribal nations within the Nevada area and seeing, what's working best, and what could we always step our game up on, for sure. But I think that just trying to be on the ball, no matter how exhausted, no matter how worn out you are, continuing to look for further funding so that we can hire more people to come back home and help with this pandemic, so that hopefully we'll be all here when it's over. Um, is our biggest feat right now. And I think, just like you said, is we can do this, we're going to get it done, and we are going to be here once it's all over. So, again, just staying together, making sure that all of our staff and all of our community have access to, mental health, making sure to promote health and wellness in the meantime is, make that time out for yourself, take care of yourself, continue to eat right, exercise, and do the things that make you happy, because again, tomorrow's not promised, with or without the pandemic right now. And so we're also looking at starting a lot of food security programs on our reservation, such as not only the commodity food program, but food pantries, food sovereignty, with some of the funding that we were able to obtain. So continuing to look at those next steps and think about, where we could do better, for sure.
That's exciting, and it's exciting to hear you have such a big perspective on this. Right? You talked about wanting to even think about having more of your people come home to work, right, and serve the people. Um, and obviously, food is huge, to be reconnected to traditional foods when we can, to be connected to the land.
Right.
If we're not eating right, we're always going to be behind the eight ball,
Yeah.
and it sure feels like so many of us keep oh, I shouldn't have that bag of chips, and oh, I just ate it anyways. we've,
Right.
we've got to break the pattern on some of this stuff, and it sounds like you're trying to do that and thinking far ahead, and that's wonderful to hear, and it's a tribute, I think, to your vision and your perspective, so thank you for that.
Absolutely.
What let me, before I let you go, um we got the holidays coming up, and you mentioned, or at least the winter holidays for a lot of people. Uh, what do you do about mental health? So last year, the winter holidays, Christmas for some folks, and other gatherings were canceled, right, because we weren't getting together.
Right. Right.
And this year, maybe more people are masking up than not. But what are your thoughts on mental health and gathering and getting together and trying to have a celebratory time when things in the world are so up the air and unsettled?
I know that, not only my own tribal nation, but Indian country as a whole is hurting because we have not been able to practice ceremony, have our gatherings, and that's who we are as people. But, again, we're resilient. We overcome and we adapt. And I think that, right now we continue to monitor our own respective nation and say, how are we looking, what do the holidays look like. We still continue to make sure that we put on, Christmas dinner, but in a drive-through style, and we're still handing out presents, but we're also limiting, how many people can come out at one time, um, making sure that masks are mandatory, each and every day on our reservation, social distancing, when we do hand out gifts. So we're taking steps to open up slightly, but continue to monitor. Right now we're doing okay where we are going to proceed with holidays and let people do what they feel is safe in their own environment. And we're going to be there, whatever the results may be. Mental health, like I said, I think it's just making sure that we have the access to the providers at the health clinic. We're continuing to have our gyms open, with the safety protocols in place. making sure to have our fitness center open with, classes available, again, with safety protocols in place, and just, those options. We also have a coffee shop, that's just opened on our reservation, Next Evolution, and they are offering all sorts of, wonderful drinks, healthy foods, different varieties of things. So, we're continually thinking outside that box on, how we can help our people continue to stay safe and healthy at the same time.
Well, that's awesome. Well, Chairwoman, you go by Chairman.
I
Is that
do.
well, Chairman? Thank you very much for your
Yeah.
time. You look great tonight.
Thank you.
Appreciate your leadership in Indian country, and uh, I hope you get a few hours sleep tonight in between all your meetings.
Yeah, thank you so much. Again, Pijat, I hope you guys stay safe and stay well. And thank you so much again for the opportunity to join you. It's always a pleasure.
Thank you. Take care. Well, that's Chairman Amber Torres of the Walker River Paiute Tribe in Nevada. Uh, Busy weekend of meetings and preparations for the U.S. Department of Agriculture consultations coming up this week in Nevada there. This is a conversation about the state of COVID-19 in Indian country. And thank you for joining us. If you're tuning in, maybe football is going on in the other room and you're footballed out on a Sunday. The pandemic is still with us, and there's news in terms of boosters, right? If you've got the shot, if you've had the shot, there's my card. If you've had the shot, the recommendation is all adults get a booster. And then the question is when. So 6 months after your second shot, if you did the Pfizer or Moderna vaccine, 6 months later, so mine was April and May, count 6 right about now. So I just got the booster. And then 2 months after Johnson & Johnson, which was the single dose, right? And in terms of a booster, the studies are showing any of them work. So you could have gotten the Pfizer up front, but then you could get the Moderna as a booster if that's what's available. You don't have to have exactly the same type of vaccine that you had the first time. And there's studies about the efficacy and the effectiveness of all of them. But right now they're saying any of them will do the job. And the other news is that children ages 5 and older are eligible for the Pfizer vaccine. And that is an emergency authorization use. And they're continuing to study that data and the data of Moderna and J&J to see if children will be eligible for those vaccines. But for now, Pfizer is good for children ages 5 and older. This is part of the We Can Do This Indian Country campaign. And right now I want to place a radio spot that's been recently produced by G&G Advertising, a Native American firm that's been working on the campaign. And this is a tribal radio spot, and let's hear the message to get people talking about COVID.
Sweet dreams, my baby. There we go. All snug, sweetheart. Have a great day. Oh, wait. Don't forget your basketball.
Thanks, Mom.
You cradled them. You buckled them. Now it's time to get them vaccinated. COVID-19 vaccines are highly effective in preventing hospitalization and death, even against the Delta variant. It's more important than ever before to protect yourself, our communities, and all our loved ones. We can do this. Go to vaccines.gov to find vaccines near you. Paid for by the U.S. Department of Health and Human Services.
Well, that's a radio spot that's part of the We Can Do This Indian Country campaign, produced by G&G Advertising. and it sounded very real. And I love those voices, and I love the singing. Sounded like maybe Oklahoma or maybe Mississippi. That's just what I heard. But we also have family members who've been maybe relocated to places in the South and who've moved up to the northern plains and what have you. But to hear those voices, to hear the songs at the end, uh, the data show that if you get the vaccine, you're much less likely to be hospitalized, and your illness, if you have any, is going to be much less serious than if you didn't have the vaccination. And if right now we're hearing quite a bit, right, that the pandemic is a pandemic of the unvaccinated right now, with a lot of the hospitalizations and infections involving folks that weren't vaccinated. And that's just the way it is in many parts of the country. So how do we change that, right? How do we move from 60% vaccination rate across the country to 70 to 80 or even higher? I'd love to bring in another panelist speaker tonight for this town hall discussion on COVID-19 in Indian country. Armenia Frias, council member of the Pascua Yaqui tribe in southern Arizona. If Armenia is with us, I know we had her earlier. Good evening. How are you? Thank you so much for taking time. And can we call you Minnie or?
Yes. Centennial.
How's southern Arizona these days?
It is great. It's nice and warm, hasn't gotten cold, and yeah, it's beautiful.
You do get snow though, right?
We do sometimes, and we haven't gotten any. It's actually hasn't even gotten cold at all. So this week, I think it's going to get a little bit chilly, but yeah, global warming.
Did you get that heat wave that they had a few days ago? Was that up through Tucson, or was it already just warm there?
It's just warm. It was like
Yeah.
80 degrees, 82 degrees. Yeah, it's just unusually warm.
Yeah, wow.
So,
well,
kind of chilly in the morning, and in the afternoon, it's just warm. But it's nice, it's beautiful. You just can be outside and you don't want to work, but you have to. Got to take care of business.
Well, thank you for joining us on a Sunday night. What's the state of COVID-19 there at Pascua Yaqui?
Well, just like everywhere, we are doing our best to take care of our community. One of the things that I wanted to share is that with Pascua Yaqui tribe, it is, we have about 21,000 members in our tribe. And what makes us unique with other tribes, I believe, is that we have a reservation that has about 6,000 members, and the rest of the members live outside the community. But these communities we recognize as tribal communities. So although they're not on trust land and they're not considered reservation, the tribe, we consider them traditional communities. So in these communities, we have offices and we provide services. So we also work with and we have tribal, citizens that live in these communities. So it's been with the pandemic, it's also been very difficult for us to, control and even track the pandemic because they're not within our jurisdiction. So when we're working on the reservation, it's a lot easier to say, okay, have a little bit of control. But when they're living in the city of Tucson in our traditional community, or up in the town of Guadalupe, or in California, we don't have that span of control. So we work with local jurisdictions and we work, with who we can in order for us to get numbers and to work with urban communities to really help control the pandemic. But we're doing a really good job, I believe, to do what we can in those communities because they've been long long relationships, with the exception of California, where we don't really have established types of networks within the community with other types of health centers. But in Guadalupe and in Tucson, it's been different. But I wanted to share that because it's a little bit different. And like most Indian communities, a lot of tribal people live off the reservation, but a lot of tribes don't necessarily provide services off the reservation, and we do. And so throughout this pandemic, it's and a lot of our tribal members live in Arizona, so kind of working throughout these past 2 years has been definitely a challenge, but we're doing our best, and we're continuing to stay hopeful also, even though it's been difficult. But we always have to think about the future and think about what we've already been through and think about what we need to do to take care of each other.
Well, that's that very helpful context, and a credit that you all do serve folks that live away from your main headquarters there, which I know differs by community. I've been living in the Upper Plains and the Upper Midwest for years, and some of our Ojibwe and Dakota tribes in Minnesota try similarly, to serve their urban residents, in particular in the cities, if they're, away from the reservation. But it sounds like you have an even more complex multi-site system. So say up in Guadalupe, you all operate your own clinic. Is that, or do you partner with somebody then?
Yeah, we have offices there, and we operate some services. And during COVID, we have been working with the Urban Indian Health Center there to do the vaccines and to do testing, and with our nurses that are there to provide those types of services now. So we do have nurses there, but since the pandemic started now, we've been collaborating with the Urban Indian site there with Nachi to provide those services. Before, we didn't, we provided some services with them, and we did a lot of prevention with our nurses, but since the pandemic, that's a collaboration to happen, and with the town. So it was with the town, with Nachi, Native American Health Center, and us, our nurses, to really work with that collaboration. That would include also the town. So it was real collaboration, because we couldn't do it without it, because the town is not just tribal members, it's everybody that lives in the town. So those are kinds of things that we had to think about, thinking about the virus was, wasn't discriminating against who's a tribal member, who's not a tribal member. It's everybody who's in that area get tested, get vaccinated, because everyone has to be protected.
Well, I would love to read more about that if anybody has time to write about it, because that happens, I'm sure, in some places, but unfortunately not in enough places, right, where there's not been historical cooperation, much less coordination on anything, right?
Right.
It's sort of been, we can't serve you because you don't have this paper, and
right.
We're not going to serve you because we don't like you. So then nothing happens. What, in general, what's your community's response been to vaccines and masking up?
Well, initially, I thought it was positive until we made it mandatory. I think, I really give credit to the community and to our whole incident response team. And, the tribal council has been involved from the very beginning to ensure that the community has been protected. And also just doing everything that they can to ensure that the resources are there for the community. And that is really because we know that we are a high-risk community. as far as we know the health of our community, our elders, our precious resource, and we know that we need to take care of ourselves. And also, so right away, we took action. So the masking and, making sure that, whatever, closing down casino for a while, closing down offices for a while, all of that stuff was what was necessary, and there weren't any arguments about it. Later, changes in, having to wear masks. We've never stopped wearing masks in the office. Certain things that we've done, not having, social gatherings, not having certain things. We've pretty much stayed pretty conservative. We started to be a little less. We started to ease back on a lot of things because it became safer, and still kept, reasonable things in line as far as safety protocols. But, we allow people to continue to, do things in reasonable ways. But once the vaccine came, people started getting vaccinated, and we were very happy about that because the community was responsive, and that was great. Then when it became mandatory for only employees, we haven't required it for the community. I thought it was going to be just easy, but it's been, a little bit of a challenge. Not so much, but I think it's just because there is misunderstandings and a lot of information that false information that people do believe. And so there's still education that needs to be done. And a lot of people just don't hear that education as much as we try to do it. They just don't hear the facts and believe, false information, or they just don't want to get vaccinated. So, we do our best, but we do have a pretty good vaccination rate. It's at 70% for adults. But once we started pushing for the 5-year-olds, it pushed down to 57%. So, but that's still good because we started pushing, for the 5-year-olds. And once we started doing that, a lot of the families started coming in with their kids, which is really good. And we didn't intend to do boosters at the same time we were doing the kids. But since a lot of grandparents were coming in with their grandkids, it was a no-brainer to just do the boosters while they were there. So just might as well do boosters. So the nurses just stepped up and said, hey, let's just open up another room and do their boosters while they're here. And so they just started doing boosters while they were there. And even some of the, younger grandparents that weren't falling in that line of, at that time, being eligible, they were, still allowing them to get boosters. And so so it's been going very well. And I think it will continue to go well because people are now seeing that it does help. And sometimes it just, takes people a little bit longer to understand. And it's just, information that they just got wrong, for whatever reason.
Mm-hmm. So is it that all tribal employees need to be vaccinated? Everybody?
Yes.
The casino and everybody?
Yes.
Yeah.
Mm-hmm. All of our employees.
Yeah. Well, it's interesting how you hear some politicians say they're pro-vaccine, but they're anti-mandate. And I don't know if that's about all politics, maybe, there's a lot of politics into that, but it's very interesting that people try to have it both ways.
Mm-hmm.
When the data show us, right, that it's the unvaccinated people who are getting the sickest and who are in the hospital. And people think, oh, it's not going to, I'll be fine. I'm young, I'm healthy or whatever, but it doesn't work that way. I've got a close relative who got sick and who still isn't feeling well and can't taste or smell, right?
Right.
And so we don't know what the long-term ramifications of the disease are going to be with everybody.
Right.
And I'm more likely to be infected if I'm unvaccinated, and then I'm going to get my relatives sick potentially, right?
Right. Right.
So
Right.
what
Right.
what advice would you have to other tribes or other communities? It sounds like you all have had to work even harder with these different collaborations to serve your people. It might mean longer days and maybe an extra meeting or more, right, with the coordination. But I'm guessing the impacts are greater when you work that way.
Mm-hmm. Yeah. I think we have a good team. We have a good team with our incident response team that meets on a regular basis and meets with the tribal council on a regular basis to share, what do we do next? And basically, we are very in touch with the community, just like every tribal community is. And I think that's what's different about Indian country. Our response to COVID-19 has been, on the pulse, right? We don't have that delay, and there's no, layer. There are no layers here, right? It's just you hear straight from your tribal membership about, are we going to have this Christmas party or not? And then you basically, go to your incident command and it's like, are we going to have this Christmas party or not? And figure out, is it safe? And if it's not, we're going to figure out how we're going to do it. And then we share it with the community. Listen, this is how we can do it in a safe way. And you don't have to wait to go around, all these layers. And I think that having that instant communication and that type of communication that you can share back to your citizenship, whether it's, about these types of events that, can make people, say, hey, let's have a good time, as you were sharing earlier, or about access to care, or about, services, is my, are we going to close down because I'm hearing about this new variant? Am I going to have to worry about the schools closing down because we don't have our own schools? It's the public school system. Am I have to worry about, childcare? Are we going to go back to where we were last year? Things that parents worry about in the workforce. These are kinds of things that we can, when we're meeting on a regular basis, that we can share with our community members and our workforce in a time-sensitive way, where you don't have to have, all these bureaucracies enabled in order for you to have these answers. Last week the president was talking about, about these tests and having tests available for reimbursement through your insurance company, right? How do you get these tests at Walgreens and then have them reimbursed by your insurance company? Well, how does that apply for Indian country, right? When you're in IHS, and as Basco Yaqui, we have our own healthcare system. We have our own plan, so the UM plan. We've always had our own managed care. It's a unique system. We had it before any other tribe. And last week, before the president even announced that, our vice chairman was asking, how do we get access to those tests? How do we get those tests why can't we have those tests sent home to our tribal members so they can test at home? How would we get them those tests? Can't we just give them, can't we just give it to them, especially like foster parents and, people that need them, and like elders and people that can't go to the ER, because our ERs here are already full. So there is, there's a lot of things to think about. And we were already thinking about these solutions. We're thinking like, yeah, why don't we get vouchers? What if we just got a voucher? We got a coupon. And we said, hey, here's a coupon, and we got the test because they're like $25. We were already coming up with these things. And then the president's talking about it, and we're thinking, how does that apply to us? Where's my voucher? We just need a coupon. We just take it in because we don't have that type of insurance, but he wasn't talking about Indian country, and we were already talking about how do we get those tests. But I know I'm already going off about something else. But my point is, we're sitting around the table and we're already thinking about the community and how can we get tests for our people that are at home, like foster parents or elders or caretakers, or that already know they have symptoms, and we don't want them out there in the community exposing anyone, And so my advice is, as tribal leaders, is that having these weekly meetings and having these discussions with your incident command is really helpful, because as tribal leaders, you're always hearing from your community. And a lot of times, these other people in these other positions, they don't hear what you hear as a tribal leader. Because as a tribal leader, they call you and they tell you everything. And sometimes it's difficult to hear it, because sometimes they can be very nice and sometimes they're not. But it's always important. What they share with you is always important. And that information that they share with you is useful. And just like that conversation, it's like, how do we help that person? Because there's always somebody else that needs that same kind of help. Like, how do we get those test kits to people that don't have $25 to spend it at Walgreens?
Exactly. It's very interesting that you're thinking already ahead of where other people might be, and that just causes me to think of the example of other tribes taking leadership as you have on managed care, but other tribes have taken leadership, say, with a model of dentistry that is for the nurse practitioner for dentists, right? That dental therapist, where the tribe in Washington State used tribal sovereignty to hire one of these dental therapists who've been trained in Alaska and who was being prohibited from practicing by state regulation. But they said, hey, we're a sovereign nation and we're going to hire this dental therapist. And boom, it opened the floodgates so that other tribes in the state are doing the same. And Oregon and other states now are looking at dental therapy, not just for tribal people, but for everybody, right? Because if you have a toothache, you need somebody to fix it. And sometimes the dental aide or the dental assistant can't do it, and the dentist only comes to town once every other week. So what do you do, right? So congratulations on leading the way with your managed care and managing just a crazy complex approach, which is just a real credit to you. It's just something there. It must be the warm weather helps you all be more creative. So have you had to adapt some of these holiday gatherings? Are you in that process? I mean, you could move more of them outside if the weather's good for sure, but what have you had to do?
Yeah, we have. We actually are just looking at it because it hasn't happened yet. It's going to happen in the upcoming weeks, and we're looking at just doing the whole drive-through outside, and having, which we did the last time. We did that with Halloween. We did the whole drive-through and had the kids come out and do Halloween drive-through, and so yeah, that's what we're looking at. Just kind of having just events outside, which is really nice because the weather is nice, and people can just enjoy the outdoors. And actually, we always have it outside, so it's really nice. It's just that you just can't have them everyone congregating. So it's just you just got to get your stuff and go this time, just the drive through, walk through, if you don't have a car, just walk through and go ahead and go home, because there, the reservation, it's small and people mostly would just walk anyways and just get their little toys and hang out. But this time it's just kind of, they would just go back.
Well, Council Member Frias, let me pause just 1 second and play one thing for you if you haven't seen it. But this is a snippet from the We Can Do This Indian Country campaign, and it was a little clip on social media, so it didn't show up on everybody's social media. It just kind of depends on where it's going to show up or not. But see what you think. And I really like the energy of this clip. It was featuring a performer. I don't know if you've heard of him. I thought he was down in Arizona, Superman, on a recent tour. He blends hip hop and culture, and he dresses powwow style, and he has a really kind of contemporary take on what it might be to be a member of the Crow Indian tribe in 2021. And he was featured in this social media spot for We Can Do This. It's really short, so watch it and we'll come back and we'll finish up with you.
Okay.
Thanks.
Honor our past, be influenced by those who came before us, and rise to make a difference. It's easier than ever before to be a modern day warrior. Let's get vaccinated so we can get back to making history. We can do this.
I wish I was that cool.
Me too.
No, you are. What do you think of that? We need a lot more of that, don't we?
Yes, we do. I love it. I think that these young people, I think they are the message and the messengers that will share that. I see what our young kids are doing with sharing these messages about COVID-19 and the future. And I think we need more of that. Because it brings hope. And I love it, because we can't give up.
Exactly. Well, are there any thank you for that message and reminder, right, that it's you got to keep on keeping on, and sometimes it's just exhausting. And I'm sure you Chairman Torres joining us from a consultation planning on agriculture, and bouncing right, same with you at Pasquayaki, right? You go from agriculture to climate to water to health to education to culture to fires burning to right on and on and on, and it's got to be exhausting sometimes.
Yeah, right. But we always have to remember that we are all, we're one nation, we're one tribe, we're all related, and we all have to take care of each other. And that is the thing, we all have to take care of each other, and we have to. It doesn't feel like 2 years. Sometimes it feels like it's gone so fast, and then sometimes it feels like it's been forever. And we cannot let our guard down when we want to take a break, and sometimes when it just feels like just forget about it, and we just can't, because it's not over. Every time we feel like we can relax, then we hear about this new variant. So we just have to remember that it's our responsibility to take care of each other, so that this next generation, like this young man, can build that future for the next generation. So we have to think about that. It's our responsibility to take care of each other for the next generation.
Well, Councilmember Frias, thank you so much for joining us. It's great to see your face. And we didn't talk about bicycling, but it's also fun to see you on Facebook with your long rides that have kept you so thin and energetic with all the tribal work that you have to do.
Thank you. Good to see
Thanks
you
for
too.
joining us. Take
Thank
care.
you.
Be well.
You too. Bye-bye.
Bye-bye. That's Council Member Erminia Frias from Pasquayaqui, just on the southern edge of Tucson in southern Arizona. And you heard Council Member Frias talking about the very interesting health delivery system that her tribe has. Where I'm from, on the reservation, people go to the IHS clinic hospital, right? And then maybe you might get referred out to other places. So it's just like go there, and there's no options. And if you live off the reservation, you're kind of on your own unless you go back to the reservation. So at Pasquayaqui, they're trying to serve all those people who are spread out, which can't be easy, particularly over the last 2 years of dealing with the COVID-19 pandemic. A couple of weeks ago, Dr. Anthony Fauci, who works on infectious diseases and has sort of become the go-to expert on COVID-19. He worked on the HIV epidemic in the 80s and 90s, and now he's become almost the most well-known person when it comes to COVID-19. Well, he spoke at the Tribal Leaders Summit, the White House Tribal Leaders Summit, going on 3 weeks ago. And this was right before the new variant came out. But when you look at the data, it's the Delta variant that's still the predominant one. So why don't we listen to what Dr. Anthony Fauci said at that White House Tribal Leaders Summit? And this is sort of a overview of why the pandemic is so critical to Indian country, and is even more reason to be vigilant and keep up our guard.
As you can see from this slide, the United States has been very severely hit by this historic pandemic, making this the worst outbreak of a respiratory illness that we've experienced in well over 100 years. This is a slide showing the various surges that we've experienced since the winter of 2020, 2019, 2020. I want you to focus on the right-hand part of the slide, where you see where we have peaked from the summer surge and have coming down. However, over the last few weeks, we're seeing a plateauing of cases at around 70,000 per day, an unacceptably high level, and I will get back to that in a moment when we talk about boosters. For those who get symptoms, and about 30 to 40% of people get no symptoms, but for those who do, about 80% are mild to moderate, and about 15 to 20% are severe to critical, leading to a variable case fatality rate of anywhere from 2% or so up to close to 20% in people who require ventilatory assistance. Among the individuals who do get severe illness, they are very heavily weighted towards the adults, mostly elderly individuals, and people at any age with certain underlying medical conditions. Because those who get severe disease and have a strong propensity to that, it is almost always related to the underlying medical conditions that they have. They're listed on their slide, but prominent among these is obesity, diabetes, hypertension, chronic lung, and cardiovascular disease. Unfortunately, these are conditions that are much more prevalent among the tribal nations as opposed to the general population. Now, for those who get manifestations of severe disease, it's a wide spectrum, dominated by the acute respiratory distress syndrome, but also there are neurological, cardiovascular, and kidney involvement, as well as a hyperinflammatory and hypercoagulable state, leading to multiple organ system dysfunctions. Look at that top red bar. American Indians and Alaskan Natives clearly dominate that picture, even more so per 100,000 population than African Americans, Hispanics, and Asians, and certainly Caucasian populations. Again, a double jeopardy of vulnerability. There are therapeutic interventions that can prevent you from going to the hospital. One is to target the virus. The other is to moderate the host response. For example, when someone has an aberrant inflammatory response and we treat them with common steroids like dexamethasone. But to target the virus, we have one FDA-approved IV drug called remdesivir, other antivirals, particularly oral ones, that are now being tested, and a whole group of monoclonal antibodies. If you need monoclonal antibodies, there's a Combat COVID Antibody Call Center, which you can get merely by calling this number or going online. And these are the list of the 3 vaccine platforms, the 6 companies, and their status. As you know, we now have one vaccine, the Pfizer-BioNTech, getting full approval, and 2 of them, Moderna and J&J, getting an EUA. What is the status of vaccines for children? We now have EUAs, or emergency use authorization, for Pfizer from adolescents 12 to 17. Again, we have an EUA for children 5 to 11, very recently given. And now we have other approaches towards getting enough data to see if we can even vaccinate younger individuals. The results are really impressive. If you compare a vaccinated person with an unvaccinated person, in the era of Delta, you diminish by 5-fold at least the likelihood of being infected, and now recent data by 10 to 15-fold the diminution in the risk of hospitalization and deaths. These vaccines are safe. 7.3 billion doses have been administered globally, and over 435 million doses in the United States. However, there's a challenge now, and the challenge is the Delta variant that has a much greater transmissibility than the Alpha variant that we were dealing with several months ago. This brings up the issue of a booster shot. The red bar is the rate of confirmed infection per 100,000 in those who were not boosted. The blue bar is the rate of infection per 100,000 in those who were boosted. When you look at the unvaccinated in red, that's the infection per 100,000 of severe disease in individuals 60 or over. The blue is if you've gotten 2 doses, but look how low the boost gets you. The message I'm getting to you is that boosters will soon very likely be available for everyone. And I encourage the tribal nations, particularly those who've done so well, as the Secretary mentioned, in getting people vaccinated in their primary vaccination. When the boosters become available, get them. We are in a race with a formidable virus. We have the tools, highly effective, safe tools. If we apply them both with primarily getting vaccinated and with boosters, we unquestionably will win this race against this formidable opponent.
Dr. Anthony Fauci speaking to the White House Tribal Leaders Summit a couple weeks ago, and you heard him go through the impact of COVID, which is the percentages are much worse, right, with folks who have underlying health conditions. It's unfortunately largely those folks, right, with chronic conditions who are going to see the worst of it if they are to become infected. We know with the Delta variant that the Delta variant is more contagious than previous versions. And we're waiting now to see what the test and the data on this new Omicron variant show. Will it too be more contagious? But with Delta, we saw that it was more than twice as contagious as previous variants. And then the hospitalization rates, right, with the Delta variant also very high. So Indian country is certainly not out of the woods. And you heard earlier tonight, Councilman Torres from the Walker River Paiute and Council Member Frias from the Passwayaky talk about, we're still at it. We're still pushing. We're still fighting the variant. Earlier in the news, when COVID was first happening in the early 2020, Indian country was literally among the hot spots, right, in the United States. Some of the Apache reservations in Arizona, the Navajo Nation as well, were experiencing high rates of infection and serious illness at rates much higher, right, than the rest of the population. A couple months ago, Jonathan Nez was speaking, the Navajo Nation president, to a conference in Phoenix, and it was the American Indian Science and Engineering Society conference with actually a much greater turnout than they had expected because of the pandemic. And even though they were masking up and maintaining social distance, they did, not even though, but they got quite a turnout of, more than 1,500, even close to 2,000 people, many young people, to students from high school and college. And the President Nez of the Navajo Nation tried to use that opportunity to talk to these young people and encourage them to consider careers in the health professions, to consider going back to the reservation after their studies on helping, just as Chairman Torres said, that maybe one result of this pandemic is that we'll have more people coming home, wanting to help our community. So these remarks are a couple months old now, but they're still very fresh in our minds in terms of a prominent tribal leader, President Jonathan Nez of the Navajo Nation, and what the last 2 years of his life have been like, fighting what he calls a monster, right? Fighting this monster, COVID-19. So let's take a moment and hear Jonathan Nez's remarks.
That there are many monsters that have been sent to discourage us. What are those weapons? What is the armor? I'll give you an example of what we're going through right now, COVID-19. The armor that we have is the vaccination. The weapons that we have to fight off COVID-19 are our masks, our protocols that have been given to us by healthcare professionals. 6 feet apart, washing your hands with soap and water, and staying at home. See, we utilize a different worldview, ladies and gentlemen, my children. We utilize our way of life teaching. It's not being forced to stay home or to be forced to wear a mask. We are here because we want to help our elders, our children. By wearing a mask, it's not being forced to do something that you don't want. Wearing a mask shows that you are a warrior, that you are protecting your family, your community, and your people. Indian country is the most vaccinated people in this country. For the Navajo Nation, it's over 70% of being fully vaccinated. You know, give Indian country a big hand. And it's because we look through this worldview of protecting our family members. And that is why we're going to persevere. We are going to overcome this COVID-19 just as our ancestors overcame some of these difficult times in the history of all our people. We persevered. We're overcomers. We're resilient, right?
That was Jonathan Nez speaking to the American Indian Science and Engineering Society conference in Phoenix a couple months ago. And as one of our speakers tonight said, I think it was Council Member Frias, you know, Indian country, her tribe never stopped, right? Never stopped wearing masks. And I've been down to the Southwest a couple times this year, and masks abound in hotels run by some of the tribes, in every place on the reservation. You know, people had masks on, and we're seeing, right, a renewed hotspot, if you will, in New Mexico of greater infection rates. I'm based in Minneapolis, Minnesota, and we've been a hotspot in Minnesota, and the scientists aren't exactly sure why, right? Exactly why these hotspots are popping up, because in some instances, such as Minnesota and even New Mexico, right? New Mexico had quite a high vaccination rate. So one theory, right, is that people got their first 2 shots, and then that the efficacy of the vaccine was going to reduce over time, and so people would become more vulnerable the farther after the shot. So the importance of boosters. So that's the theory, and I know that's what they're testing now. So go get your card. You know, go get your card. Go get your shot. The first shot for me wasn't terrible. Just obviously the needle hurts a little bit, and then kind of tired. And as I saw somebody in the paper today said, you know, it's one of those, you might want to just go curl up with a blanket for a while on the couch. That's kind of how it was for me too. And then the booster was fine. You know, again, a little fatigue, and the needle hurt. For some reason, hurt more than the first 2 shots. But then boom, all good. And now I'm looking forward to spending the holidays with my parents in their late 70s. And that was the real reason to do it. This is part of the We Can Do This Indian Country campaign. And we've heard a couple of the resources from the campaign tonight. And I want to play one more for you. This is all about getting a conversation going, right? And who better to have that conversation with than your auntie?
Hello?
Hello.
Hey, who's this?
Who's this? It's your Auntie June.
Oh, what's up, Auntie?
Your drum group. Were you practicing last night?
Yeah.
It's a little quiet.
What?
How many people are in it?
6?
Ah, I thought so. It did not sound like it last night. Sounded like dog water.
What's that supposed to mean?
Ah, jokes, Sonny, jokes. But let me just say, we could definitely tell there was the 6 of yous.
Well, only 3 of us got the COVID-19 vaccine, so we had to do what we could.
Ah, well, as the leader of the group, you need to be that positive influence and help them all get vaccinated. Maybe give them a ride to the appointment, or a call reminding them.
Yeah, you're right. I'll let the others know. The vaccines are safe and effective. Plus, anyone 12 and older is eligible to get vaccinated now.
Attaboy. Now start making those calls before I do.
No way. I'm on it.
We can do this. Go to vaccines.gov to find vaccines near you. Paid for by the U.S. Department of Health and Human Services.
You can tell that spot is just a little old, because now the vaccines are, all vaccines work for 12 and older, and the Pfizer vaccine, one of the 3 vaccines, works for 5 and older. And the boosters, all adults are recommended that you get your booster 6 months after Moderna or Pfizer, or 2 months after the Johnson & Johnson vaccine. But if you're an adult and you've had your vaccines, talk to somebody now about going to get the booster. Why not? Winter's coming, and you might as well get your regular flu shot too, right? While you're getting the COVID-19 booster. This is part of the We Can Do This Indian Country campaign, and there's more of these resources at wecandothis.hhs.gov. There's more information about what vaccine and what vaccine information that you might have questions about at vaccines.gov, vaccines.gov. Children 5 and older are eligible for the Pfizer vaccine. And the other vaccines are probably coming soon to children. There's some studies and data pending on them. And then all adults are recommended to have their booster. All adults, 6 months after the second of your 2 shots, if you got Moderna or Pfizer, or 2 months after J&J. And the data are showing that if you get your vaccine, you're going to be much less likely to get seriously ill, to end up in the hospital, to be faced with long COVID unknowns, losing your taste or smell, and you're going to be much less likely, if you happen to get infected, because you still can get infected even though you've had the vaccine, you're much less likely to spread it to elderly people, to the vulnerable at-risk folks with the underlying health conditions in our community. So talk about this in your families. We can do this, and we thank our guests tonight, Herminia Frias, the tribal council of Passawayaki, and Chairman Amber Torres of the Walker River Paiute tribe in Nevada. I'm going to leave you tonight with a little more of the music that we started our conversation with. Shantae Standing Rock, an enrolled member of the Rocky Boy Chippewa Cree Nation in north central Montana, just south of Havre, Montana, there in beautiful state of Montana. And Chante joined us in our last conversation, and he left his music with us to share. And he's a young man, a student at Montana State, and he went through COVID and got sick and got infected, and had a rough few days and got through it. But certainly recommends that everybody give serious consideration to getting the vaccine, not only for our own health and wellness, but for those around us. So we'll leave you tonight with Shantae Standing Rock's music. Be well, stay healthy, Indian Country, and take care.
Hey, Through song we pray, through dance we think of our loved ones. We pray for good health and happiness.